Thank you so much, Leslie, for that wonderful introduction. I think a few things when we do these types of introductions that are missing include that for me, when we talk about some of the topics from today that are so important, is that I have been both a family caregiver for a person living with dementia and dealing with all these ins and outs and the minutia of the day to day. But also in my professional realm, I have also dealt with a lot of these significant issues that we're going to be talking about. So I always say that when I talk about dementia care, I always call it fostering compassionate care because I think that it's just so important for us to talk about dementia care in this way. And I just think it's an important consideration just in general. So I think those are two important things for me from moving forward, like that you need to know. And so the course of my conversation today with you all, and I call it a conversation versus a presentation or webinar or something like that, is because I think it's important for us who are caregivers to sort of be on this journey together and really understand what compassionate care is, really understand how we reframe some of these challenging behaviors that we often see in the care of persons with dementia. And then how do we use those compassionate caregiving tools? And I'm going to provide you with some framework for how to do that, how to sort of move past, where I'm at in the caregiving journey to where I'm at now. And something I also want to share when we talk about dementia care, and I jumped in late to the earlier discussion, but I'm sort of operating under the assumption that most people here today really already know what dementia is, sort of as that umbrella term. We all know that it's that progressive disease that really impacts memory, impacts that ability to conceptualize and process information. Um, we also pretty much all know, depending on where we're at in the caregiver journey, whether you're a professional caregiver or at home family caregiver, that these changes really impact that caregiving journey as well. And on any given day, that caregiving journey can really go from us feeling like we have charge of everything, really kind of building what I call that matrix of caregiving, up to being that Jenga puzzle where we're just sort of pulling pieces together because we don't know what to do and it's all falling apart at any given moment. And from a personal standpoint, I want you to know that I have been there, especially from that personal caregiver journey experience that I've had in my life. Um, when I think it, well, I guess just a step back. When I was about 7 years old, my grandmother was diagnosed with Alzheimer's disease, and it was just such a impactful experience for me that throughout my life, many members of my family who were diagnosed with this disease or had any type of cognitive impairment, I sort of ended up being on this journey with them. And I think that's really important for me as a professional to sort of understand the impact that this could have on those individuals who are coming from various professional experiences to have. But also, I think that for me personally, I got to see that journey and what that was like for individuals. So I sort of understand like that experience that individuals might have where you're going from really building up that caregiver journey. You feel like you have everything in control. You feel like you've um, sort of maybe figured out what to do with your loved one or that person that you're paid to take care of who needs this support. And then all of a sudden, one thing sort of just kind of causes this process to crumble. And when we talk about Alzheimer's disease and related dementias, I think that part of the issue that we often have with that is the way in which we talk about dementia. It's the way in which we talk about Alzheimer's disease, and that so impacts when we have individuals who might have co-occurring mental well-being challenges and dementia care challenges. So I'd like to hear from you all, either in the chat or you can unmute yourself. When you hear the words dementia or you hear the words Alzheimer's disease, where do you go immediately? What are the first words that come to mind? Can you share that with me?
Forgetful.
Okay, forgetful, devastating, forgetfulness, changes in relationships. It's a hard one.
Agitation,
Agitation,
Confused,
lonely. I'm sorry I didn't hear the last one.
confused,
Confused. Yeah. And I think about these words that you just used to describe dementia. I see a couple other things in the chat I did not say. Sadness, sorrow, a long, slow journey, constant change. Okay, let's sit with those words for a minute. I didn't hear any positive things in that, right? And so when we talk about dementia, I think largely what happens for most of us is we go to the negative because we see it so much. And I think words really matter when we talk about dementia care. You know, you all didn't use these words, but you kind of hinted at them. Largely when we describe Alzheimer's disease and related disorders and dementia as a whole, we say things like thief in the night. We describe the condition as this like overarching, all-consuming thing that just comes in and takes over the person. We talk about dementia as something that robs the person. It's coming in, it's taking away from that person those things that they care about. We talk about it as a disease of old age, which means it gets immediately dismissed. And all those words, I think, are important for us to hold on to and understand. And the reason I ask you all to kind of throw that into the chat is because I wanted to hear some of those phrases that you all are using. Because I think when we talk about dementia care as a whole, what we're doing is we're removing the person. We're removing who they are. We don't talk about Joan, who lived a life, who, loved going to the movies every week on Sunday, who went to church on Wednesday evenings, who, maybe babysitted for her grandchildren throughout the week, who lived this wonderful life and who was very happy. We don't talk about Joe, who was, full of life and went and took all these art classes and was part of a band on the weekends and did all these things. You know what we do when we talk about dementia? We talk about the disease. And part of that is the problem. And that is the reason why when we talk about dementia care, we really need to think about shifting sort of our conversation to be more person-centered because we're removing the hope. We're essentially saying there's no hope for this. It's all about the disease. And what we really should be doing is saying, actually, despite all of these things that's going on with this person, we need to be throwing in some hope here. How many of you, before I move forward, how many of you are either professional or personal caregivers? Can I see can you use the emoji thing to do a hand or say yes? So we've got quite a few people here. I see you raising your hands or okay. Thank you. And I just think that's so important, right? I have been on this journey with you all from that perspective of being a caregiver, and I know how difficult it can be. And so to hear that there's no to go back to all these words that we use, that's hard for me. That is so hard for me. And I'm almost, let's see, when I first started my caregiving journey, I'm 40, I'm almost 40 now. I was about 22, 23, and I was caring for my aunt who had dementia. And I had no idea what I was doing. And I literally had no hope. I had no like camaraderie. I had no one talking about some of these things going on with dementia. I think commonly when we think about dementia, we often relegate it to, well, that person just doesn't remember. They don't remember my name, they don't remember their memories, those sorts of things. But what I found very slowly as a 22-year-old dealing with all, sort of hard launched into adult life, dealing with this, was that it was much, this is a disease that is much more than that. It's much more than just that memory piece. It was that behavior piece, which had to deal with some of these things when we talk about mental well-being, mental illness, some of these challenges that we have related to mental health that she was dealing with that were so hard for me to deal with. So I didn't have any hope in dealing with this disease as a caregiver. And so what I've come to learn as an academic, as a researcher, as a social work practitioner, really working in this space, is that when we talk about Alzheimer's disease and related dementias, it's not just the memory piece. It's a lot more than that. It has to deal with a lot more of the mental health aspects of their care that we sort of have to figure out and parse together. So these include things like repetitive acts or repetitive behaviors. These have to deal with things like hallucinations, delusional thoughts, anger, agitation, and I hope as part of our discussion today that we're able to sort of have a better framework in dealing with these things from a compassionate care standpoint. Because and let me just do a show of hands again. How many of you have, as caregivers of a person with dementia, dealt with these things? I'm seeing some head nods. Can we raise hands or, oh yeah, I'm seeing some hand raising situations here happening. Yeah, does anyone want to share like any difficulties you had with these or anything that you found challenging?
Hi, can you hear me?
Yes.
I am Sumati Devarajan. I was in my early 20s, newly married, and living with my in-laws in India and trying to pursue my medical career. And my husband was living here at that time. My mother-in-law had a history of schizophrenia, and so we developed a form of attachment where I was the daughter-in-law and a professional. And so there was no escaping. There was no break time for me other than when I
Yeah.
went to work. So it was just a very difficult period in my life, but there was a lot of manipulation as well going on, I think. But we had a very healthy sort of formative 10 months where I had to be living with them and took care of them. So it was not easy, but I'm now thankful for that time that I did have.
And I thank you so much for sharing that. I think for a lot of us, we're always trying to do that caregiver balance, right? And it sounds like what you were trying to do. You're trying to live your life as it relates to taking care of your family. You were also trying to juggle your professional life and trying to figure out what that looked like for you. And I think when you throw a lot of these sort of things onto that, whether it be these hallucinations that your loved one might be dealing with, that delusional thinking, anger, agitation, that is a lot for us as caregivers to deal with, right? Just sit with that for a moment. Think about your normal life and just how, in general, that's so stressful. And then you're adding the feelings of someone else onto this who's dealing with so much. And for me, as a caregiver, really dealing with this, it was so stressful. And especially I'll tell you, as a 22-year-old, I had no idea what I was doing, so I had a lot of caregiver stress. I had no one who was my age to be able to go and talk to and be like, I'm feeling really stressed about what's going on with my aunt, right? That wasn't a thing that I had in my life. And how I have spent most of my professional career is how do we take some of these feelings of everyone's sort of different in terms of the way that Alzheimer's disease manifests, and how do we sort of sit with that for a moment, even if it's a moment in time, and figure out how to process that and help build this kind of idea of compassionate care. And that has really been, for me, the framework of my professional career. And I know I see here in the chat that, losing that perspective of who you are as a person, as a caregiver, that's hard, right? We all know that. And I think he's sort of shifting the way in which we talk about dementia care is so important. One, because we have such this idea of what dementia is. And even from the onset, we're burdened by it because we have this language in which we talk about it. And I would like us to sort of reframe that and open it up a little bit more and think about, okay, as a caregiver, I don't necessarily have the answer to this situation in this moment. So I'm going to throw the proverbial spaghetti up against the wall and see what fits for my loved one to be able to move forward. Because I don't think there is really a cookie cutter approach to any of this work that we are doing. I really think that regardless if you're a family caregiver or a professional caregiver, there's just like, we really need to take a step back and think about what that looks like for us. And that's really where compassionate caregiving comes from. And when we talk about compassion, I would really like to hear from you all for a moment. So I ask you what you heard, like what are those first words that come to you when I mentioned dementia care? What about with compassion? Can I hear from you in the chat or unmute yourself and tell me what you hear? Okay, I'm here seeing some things in the chat here. Empathy, kindness, understanding, listening, love, patience. You're not a burden. Love and patience, warmth. Yeah, all of this is very much a part of compassion. So for the remainder of today, I would like you to reframe those words that you used about dementia in general when I ask you that question and apply those. Take all these words and think about how would you use that in your work with a person with dementia? And that's really the heart of this. A lot of times with dementia care, what we are doing as caregivers is we are very much focused on basic nursing care. And that's my word for it. I'm not being demeaning when I say that or trying to be. I'm talking about all those activities of daily living that we might be doing with our loved one. I'm talking about things like medications, bathing, feeding, or even just cooking meals for our loved one, grocery shopping, uh, daily chores, laundry, making phone calls, managing their financial situation. That to me is all what I would call very basic nursing care. And I really do think in the capacity of basic nursing care that we have such a space for us to sort of elevate that to that next level and think about the suffering that that individual is going through who has dementia. Now, most of you who have worked with a person with dementia probably have seen this in action where you have this person, either it's a loved one or a person from a professional standpoint that you've worked with for a long time with dementia, who they have these moments of recognition of what's going on, as in they know that they have dementia. And that inherently comes with this pain and suffering. And so when we talk about compassion, really at the end of the day, what we are talking about is thinking about that suffering that person is going through and how do we incorporate that into the caregiving journey and acknowledge it's really about acknowledgement at the end of the day. And so it's about thinking about how do we, throughout those activities of daily living, incorporate that acknowledgement of the suffering this person is going through. So instead of, being dismissive of whatever's going on with them, we try to think about how do we really focus in on that and let them share those feelings that they're dealing with, regardless of if they are historically accurate or not, or any of those things. We really want to just bring that into the fold of the caregiving experience. And that can be such a struggle. So, sorry, sorry, I'm coughing. I'm getting over the flu, so I still have a little bit of a cough. But what I want to do with the remainder of our time together today is really focus on how, from a philosophical kind of standpoint, we take this idea of compassion and we apply it. Because I've always been so not amused, but so like into this idea of compassion and people saying it, but then I don't see people doing it. And I thought, well, with dementia care, how do we translate that into sort of an application piece of the puzzle? And so I'm going to walk you through some examples today that I hope is helpful for you. So when we talk about compassion and that move to application, let me just share with you a story. One, I mentioned earlier that I've been a caregiver from a personal standpoint of a loved one with dementia. In my professional life, I've also been a caregiver, and one of my favorite people that I ever was a caregiver for was one of those people who with dementia who I really struggled with. I loved her. She was amazing, but she was just so difficult to provide care with or compare to. She lived in a residential community with 7 other women. And the way this residential community was sort of structured is that we really tried to work with them to provide them with whatever care they needed, very person-centered approach. And with this particular person, I'm going to call her Jane for the purposes of today. That's not her real name. But she would get up, she had Parkinsonian dementia. And from the time she would wake up at 6 a.m. to the time she went to bed at 10 p.m., she would ask staff who worked with her, "What's for lunch?" Well, for those of you who have been caregivers, that's a pretty benign question. You could deal with that, right? Think about dealing with that every like 10 to 15 minutes of your whole entire day. And that is how Jane operated. She literally would wake up first thing in the morning and be like, "What's for lunch?" And then 10 minutes later, it'd be like, "What's for lunch?" It would go on all day long, right? And because she had dementia, even though you told her what she was going to have for lunch, that did not satiate her. You would have lunch and she would stop during that one moment in time, but then come 1:15, 1:30, 2 o'clock, she would start asking what was for lunch again. So it was very distressing for us as staff who worked with her. And there were about 5 or 6 of us, and we really didn't know what to do. We were all very young, inexperienced in dealing with dementia care. And so we were kind of at a loss for this. We as a team decided she was really dominating staff time. We had other residents with much higher needs, and so we were like, how do we kind of like navigate all this? So we came together as a team and sort of did some investigation on why is lunch, like, she doesn't ask about breakfast, she doesn't ask about dinner, why is lunch so important? And we found out from her brother, who was still alive, that the reason lunch was so important to her was that her and her mother, so she had I should also step back and say, yes, she had Parkinsonian dementia, but she also had an intellectual disability, which meant that she sort of needed a lot of hands-on care. And so until her mother had passed away about 2 or 3 years prior to her living in this facility, she'd always lived, even as an adult, with her mother. And they were ladies who lunched, if you know what I mean. They went out every day, went for lunch. Some days after lunch, they went and got their nails done. That was really their special time together, right? And she was obviously very close to her mother. She lived with her and her entire life until she moved into the facility in which I worked. So for her, asking about lunch was a much deeper question, right? It really wasn't about the food she was eating. It was really about, I miss my mom. But she didn't know how to say that. That was hard for her. She didn't have the words for that. So what we did as staff was we kind of took a step back and said, okay, this was a meaningful time for her and this important person in her life. How do we make her day-to-day special? And so what we ended up doing was we made lunch special in our facility. We were able to do that. It was a small facility. I already told you we were like, we had 5 to 6 residents and several staff working with them. At lunchtime, we always had 2 staff. So we made it so that Jane, this resident, helped us plan the meal every day for lunch. She helped us cook it. And then when we sat down to have that meal together, she didn't just sit there and eat. We helped her guide the social conversation from her talking to those other residents about what was going on with them. And so I saw such value in that. And what I did was I turned that into this idea of what does compassion look like when you can do it? And I think this is so person-centered when you're thinking about persons with dementia who have other co-occurring mental health challenges, is that let's start with the why. Why are they asking the same question over and over again or exhibiting the same behavior over and over again? How do we break this down? So for those of you who are working in the field, let's think about why. Well, let's break it down a little bit further. The W from why stands for what, the H stands for how, and the Y stands for you. So what's going on with the person? What can we kind of think about from their historical standpoint that could be so important that we're trying to kind of needing to bring that into the fold of the discussion? How can we intervene? What do those interventions look like? How do we really try to figure out what looks like for the person? And then you. Sometimes as caregivers, whether we are paid caregivers or family caregivers, we got a lot of emotions. that are going on within us. So how do we kind of bring that into the fold as well? How do we acknowledge and recognize that and not place it on that person we're providing care to? And so I think when we talk about that how piece, it's so person centered because we're taking the person and we're removing them not from the dementia standpoint necessarily, but we're kind of bringing them into the center of the picture here. And I think that's so important in the care that we provide. It also really aligns the values and preferences of the caregiver and the care receiver. So what it does for us is it really helps us bring that person who we're providing care to the forefront. We are not just acknowledging who we are as caregivers, but we're also thinking about that loved one or that person we are paid to take care of, and we are bringing them to the center of this conversation. Um, and I think that all of these things are so important in terms of the care that we are providing to individuals. Um, I told you about this person that I provided care to who was really struggling. And I think when we talk about compassionate care, when we talk about those things that are going on with the individual, first of all, that what piece in understanding the history of the resident, really identifying those strategies that can be met and involving them in the process is so important. But I also think that for us as caregivers, that's important. For especially for those of us who are caregivers who are family caregivers to have those types of conversations with their loved one, even if they're not logical, coherent, or maybe start at A and go all the way to Z in terms of the conversation, they are so important because what they do for us is they give us meaning as caregivers. So we're spending that special time with our loved one. We're really building them up, lifting them up, and trying to figure out, again, this Rubik's Cube. I wish I had an actual Rubik's Cube. I need to work on that for Zoom on the future, but really trying to figure out, what's fitting in terms of the care that we are providing to this individual and involving them in the process. And we know for persons with dementia, that is so critical. And especially for those individuals who are dealing with those other mental health related conditions like hallucinations, repetitive behaviors, depression, anxiety, name it, trying to figure that out. So I think those are so important. The other example I want to give you today, because I think I have just enough time to go through this, yes. So when we talk about dementia care, when we talk about mental health, I think one of the other core concepts that we sort of see with individuals, whether we're family caregivers or professional caregivers, is this kind of concept of anger and agitation. And sometimes we, as caregivers, we're like, where did this come from? I have no idea. I don't know what to do. I don't know how to manage this because maybe we've never seen our loved one sort of in that space. And I actually do think that anger and agitation is one of the hardest things for us as caregivers to deal with because we're just maybe not used to dealing with it, especially if you're a family caregiver and you're trying to figure out, how to deal with all of those things. But in general, what we often see is that for persons with Alzheimer's disease and related dementias, they're sort of plopped in this situation, whatever the situation is, and then we see these behaviors sort of manifest. So screaming, hitting, throwing objects, agitation. Has anyone else seen other behaviors when a person with dementia is agitated that you would like to share? I've had my hair pulled as a caregiver. Trying to think. I was hit with a cane once. Um, there's a lot that can go on. Threats to hurt themselves. Okay, thank you for sharing that. Yes, threats to themselves, not just you. trying to escape, them rocking. So, agitation and aggression is very much like, can be one of those mental health related conditions that we're constantly dealing with. Um, and so let's think about this. How many of you have dealt with yourself or as a caregiver or dealt with this as a professional caregiver where you've had to deal with a shower with a person with dementia? Yes. Okay. Seeing some hands up. How difficult was that? Was that so difficult? This was the worst for me as a caregiver, was trying to give my loved one a shower. And it took me a very long time to figure out why. Um, I did not know when I first started my kind of career in this space what contributed to this, but I was like, every time I go to help my aunt with a shower, she gets so combative. And then I was in a situation where I was a paid caregiver and I was working with individuals who I had to provide personal care to, and they always struggle with showers. And I never could figure this out. Like, I just did not understand the philosophy behind this because I didn't quite understand how traumatic a shower could be. So for most of us, let's think about this. When you go to take a shower, it is a pleasant experience, right? You feel, when you're done with the shower, you feel clean, you feel relaxed, you smell nice, right? And those are things that most of us sort of value or place emphasis on. For a person with dementia, sometimes they don't always place that value or that context or that preference on that thing, that particular activity. And so that's a challenge, right? That's part one. Part two is showers for persons with Alzheimer's disease and related dementias can be so difficult because think about just the sensory overload that you might be feeling when you go to take a shower. One, you've got water hitting you from above. It's hitting the shower, the basin, and making a noise that is sort of loud. That can be a struggle for individuals with dementia. You've also got the fact that there's water pelting their skin. For some persons with dementia, that is a struggle or a challenge, partly because it's so, to them, it feels so intense and uncomfortable. It's not a pleasant experience. For other individuals, it could be just the very act of getting into the shower where we've got, just a shower basin or frame that is all white or a dark color where they think when they go to step into that, they're going into they're going to fall into a hole because of their visual impairments. So again, all of this is so difficult for the individual. And so us as caregivers, we're trying to figure out, okay, what part of the puzzle is causing them a challenge? And so when we talk about dementia care, I think it's so important to sort of take a step back as a caregiver, regardless if you're a professional caregiver or a personal caregiver, and think about how do I kind of navigate this situation? And start with the what. What exactly about the shower is causing your loved one to sort of have these challenges? Can you identify that? Can you do the routine in a way that you can identify that? So sometimes it's about um, changing your internal workflow or process with your loved one to kind of figure that out. The second part is how. How do I change this routine? For some individuals, as it relates to taking a shower, it's been more about, let's take a step back and say, why do we need to take a shower every day? Could they take a sponge bath? Could they, could we play music to calm them? Could we use essential oils to calm them. What is it that calms that individual, and figuring out and tailoring our interventions for them. And then it's about you as the caregiver. Now, I know personally as a caregiver, both from a professional standpoint and from a personal standpoint, sometimes what happens for me is that I get so frustrated, or I get so enmeshed in the situation that I don't know what to do. And I'm sort of putting my feelings on that loved one or on that resident that I'm providing care to. And so it's really important as a caregiver to take a step back and really engage in those self-care sort of activities that are so important for us. In general, some of those what things that we can think about when we talk about, really taking that step back is things like physical response, unable to communicate feelings. Our loved one or the person we're paid to provide care to might not always be able to communicate, like, I don't feel great in this situation. And that's part of the problem. They might be tired, they might be stressed out, and their response is going to look much different than our response. They might also not have understanding of the situation, meaning, especially when we start talking about the shower. I think all of us have taken a shower before. It's kind of a series of operations, right? You step into the shower, you turn on the water, you get it to the temperature you like, you're naked. For those individuals who have dementia, this is very overwhelming for them. And they might not understand at the end of the day, what's the point, you know? So how do we figure out how to, manage that with them? Um, and then, I think one of the other things that we should think about is for persons with dementia that from a compassionate care standpoint, sometimes we see these mental health related issues because of that physical discomfort that that person's dealing with. So is it pain from the activity? Have they had too much stimulation? Are they hungry? Are they thirsty? Is the person tired? What's their medication, situation look like? And so all of that can be so, so important. Um, and I think just taking that step back as caregivers, again, whether you are a paid caregiver or a professional caregiver, is so important because you really need to sort of be in the shoes of that person you're taking care of. And one last thing I want to share from a person-centered standpoint that is within the realm of compassionate care, but like a little bit outside of it, is thinking about the use of reminiscence therapy. How many of you are familiar with reminiscence therapy? Anybody? Raise your hand, please. Yeah, okay, I'm seeing a couple people. All right. If you're not familiar with reminiscence therapy, this is a very person-centered approach for persons who have Alzheimer's disease related dementias, and also those individuals who might be dealing with co-occurring mental health related challenges, like some of these behaviors we've talked about earlier. Often what we find in dementia care is that people are very anxious. People are very agitated. They don't feel comfortable because they know something's not quite right. And let's try to figure out those soothing things that we can add to their day-to-day routine that can be so helpful. With reminiscence therapy, we're thinking about things like helping to manage some of those symptoms of dementia, really creating also for those of us who are caregivers, that bond between the caregiver and the care receiver, the care recipient. How do we further have these conversations and these opportunities to connect with one another? And I think that's so important. When we talk about reminiscence therapy as well, we really sort of take a step back and say, okay, we really want to look at those visual, oral, smell, and tactile senses and kind of throw it all in together. The best thing about reminiscence therapy is anyone can do it. You do not have to be a professional. So, for those of us who might be joining us today, that you might be a um, person who is providing care to a loved one who's not a professional at all, never been trained, you can do this. All it requires is you doing things like focusing on the journey with that individual, really showing a picture from an old magazine and having that individual talk about it. Whipping out an old yearbook photo, having that person talk about it. Family albums, same way. Playing music that would have been like, popular when they were younger. All of that can really help that individual start talking, processing. The thing to remember with reminiscence therapy is we don't really care about if it's accurate or not. We really want to focus more on that person just being able to speak and share their story, um, and focus on the emotion of that individual. So their story might not be accurate, and that's okay. We might know that, especially if you're their family member, you might know that. But letting them just share whatever's coming to their mind in that moment when you share that photo with them or play that song with them and go with it. It's about going with the flow. Um, so I think those are the most important things of what I wanted to talk about today. I did want to say very quickly, just to recap, that when we talk about compassionate care, we're really focused on that person-centered approach to walking that journey with the individual and really thinking about how do we provide care that provides hope. Hope for you if you were the caregiver of that person, but also if you're the professional caregiver of that individual, how do we provide hope to those individuals who are, the family caregivers in that situation? So, really, hope at the end of the day, I think, is so important.